If jowls are starting to bother you and you feel like your face just looks heavier or less defined than it used to, you're not alone. As a dermatologist, I have studied and found the best ways of how to improve the appearance of sagging jowls, what you can do realistically in the next 30 days, and what actually makes a difference long term. I first want to set expectations right away. There is no topical skincare product that truly lifts jowls permanently, and meaningfully structural lifting usually requires procedures or surgery. That said, you can absolutely improve firmness, skin quality, and facial definition within 30 days, especially if jowling is mild to moderate or worsened by fluid retention. And in case we haven't met yet, I'm Dr. Mamina, a board-certified dermatologist determined to make understanding skincare easy for everyone. First, let's start with how jowls form. It's due to a combination of different factors. You have collagen loss, skin laxity, fat pad descent, bony changes, and fluid retention. All of these things just happen naturally as we age, thanks to gravity. It's normal aging, not something that you did wrong. Now, here's your next 30-day plan. Skin quality matters. Ingredients that help support firmness include retinoids, peptides, growth factors. These don't lift skin per se, but they improve texture and resilience, which can noticeably soften your jowls. Now, ingredients like hyaluronic acid, glycerin, and polyglutamic acid can help plump the skin and reduce that crepey texture, which can make sagging appear less pronounced. I'm also a huge believer that facial manipulation with massage, microcurrent, or gua sha can move fluid around to give you a more lifted look. Reducing facial puffiness can improve jawline definition quickly, especially in the morning. Just a quick note, if you do have filler in your face, especially if you have a significant amount, I would probably stay away from facial manipulation and massage. My favorite supportive products for the jawline and neck include Skin Medica, the TNS Advanced Plus Serum, the Elastin Restorative Neck Complex, Revision Nectarfirm Advanced, the Neostrata Triple Firming Neck Cream. These all contain peptides and or growth factors that support skin health and firmness. I mean, it's not miracles, but meaningful improvements. And I think you'll see faster changes with these products than with retinoids, but obviously it's very important that you're also using a retinoid. When it comes to skin tightening, there are energy-based devices that can help stimulate collagen, and in some cases can even melt some fat that can contribute to that jowling. So these include ultrasound technologies like Ultherapy or Softwave. There's also radio frequency skin tightening like Thermage or Zerf. Then there's RF or radio frequency microneedling like Morpheus 8 or Secret RF. And these are best chosen based on your anatomy and goals. So obviously a discussion to have with your provider. And in some cases, fillers can help by restoring volume and reducing the appearance of jowls, but it must be done carefully. This is highly individualized. Filler, especially biostimulatory filler like Sculptra in the cheekbones and jawline, can help lift the face back. It's not dramatic, but it can make a little subtle difference. And HA or hyaluronic acid fillers in the marionette lines can mask the appearance of jowls because these lines become more accentuated when there's jowling. And then what about threads? So I'm generally not a fan of threads or lifting with threads. My issue with them is that the effects can be short-lived and threads can be risky. They can lead to asymmetry, puckering. You could potentially see them. They can cause inflammation, scarring. So I think that it's just better to stay away, and it can make future treatments like fillers, lasers, or even surgery more complicated. Now, for more severe jowling, and if you have tried all of what I mentioned earlier in this video, surgery is often the most effective option. And that doesn't mean you failed. It just means you're choosing the right tool based on where you are at. Remember, for long-term results, you want to be consistent with your skincare. So I'm talking daily sunscreen, consistent retinoid use, supportive use with peptides and or growth factors, skin barrier support, and healthy skin before procedures do lead to better outcomes afterwards. If this breakdown helped clarify what's realistic and gave you a more clear understanding of what you can do next, please be sure to subscribe. Thanks so much for watching.